Hi, welcome to my channel. I'm Kate and I am the face of KR Aesthetics. In today's video, I'm going to be talking about lips. And I have a little bit of help today in the form of Fred the Head. The first thing that a lot of people who have no experience of any kind of lip fillers, even now, however many years on, this has got to be 30 years on. The first thing that pops into everyone's mind is Leslie Ash. Let's be very clear here. Leslie Ash was really unfortunate in what happened to her, and it wasn't completely just related to her lip fillers. Yes, she had lip fillers, but she had lip fillers very early on, and she had permanent filler popped in her lips, which then she reacted to badly, and then I believe she went on and contracted MRSA. So it was a whole big snowball thing. So let's get Leslie Ash and put her out the way. That's not what we're dealing with. Let's talk about lips. So what are lip fillers? When we fill lips, we fill them with gel solution of hyaluronic acid, which is cross-linked. So you've got the gel molecules and they've got little cross-links in them, okay? The degree of cross-linking will vary from product to product, and the way that we select which product we're going to use will depend on what results we want. Now, in the lips, you need to consider the fact that we need them to move nice and naturally. We don't want them to be static, we don't want them to be lumpy, and they need to be able to stretch because we need to smile and we need to pout. Because when you've had your lips done, you need to pout. We don't have trout pouts though, I don't do that. Crazy hair again. I've always got crazy hair. So for example, if we had someone who was say 25, she's got lovely skin, she's got nice young lips, she's got quite full lips anyway, and she wants something a little more pouty, you can use a firmer product. But if you've got someone, say my age, knocking on a little bit, who wants a little bit of augmentation, a little bit more definition, but without looking too much, you can use something a little bit softer. I use Teoxane products, for lips at least. They're really well tolerated by the body, and I know that they're very predictable in the way that they behave. Not just when I'm injecting them, but whilst they're in your lips and whilst they're breaking down, because over time they will break down. We say 6 to 9 months, roughly, for your lip fillers, although mine haven't been filled for nearly 18 months and they're still looking okay. I like them. I might get a bit more in soon. And when I do get my lips done, I go to a lovely lady who's a friend of mine, another aesthetic practitioner. She's a nurse. I'm going to do a lip diary, so you can see the stages of them going through, because they're always a little bit more swollen the following day and then they settle down. And I thought that'd be quite interesting for everybody to see. So that's to do, not yet, when I'm less busy. We've got July coming up, end of lockdown. Gonna be very busy. But I'll still try and do some videos. With lip filler products, we need to know how they're going to behave, statically when we're sat doing nothing, and how they behave dynamically, because we need to move. We need to smile, we need to pull faces, we need to talk, and we need to know that we can do all of these things without the filler breaking down. Some cheaper fillers tend to be quite rigid, so you've got your filler particles and you've got the crosslinks, and the crosslinks don't flex, they will snap, which leads to lumpy lips. So that's the first thing. Select the correct product for what you want it to do. Once we've selected the product, we need to obviously get it in there. So option 1 is with a needle. Option 2 is with a cannula. And option 3, which I'm not even going to entertain, is the no needle filler, which basically it's firing filler into your lips through sort of high volume vacuum sort of thing. And it's horrendous. It's lumpy, it leaves you with bruising, it's unpredictable, and it's awful. And if you're considering having that done, you may as well switch this video off now, because we are not going to get on. I personally don't use a cannula for my lip fillers. There are reasons behind using it, and your practitioner will discuss those with you. I find them quite painful for lips, and I find they generate quite a lot of swelling. But I'll show you a cannula anyway. It's a very long but blunt needle. Now, they look a bit scary. There is the cannula. It's quite long, but it's also blunt. See, and there's a little hole at the end. Pretty long. They make a hole kind of here and a hole here with a little needle. The cannula goes up through the hole and they fill the lips that way. So second option, if you're not using a cannula and you're not using the third option that we don't talk about, is a needle. When you get the filler, it comes with a needle, well, it comes with 2 needles in the box. This is the needle that comes with the actual filler. Now, I used to use this needle for my lip fillers, but I don't anymore. I'll show you what I use in a minute. This is stuck. So, here's a needle that the company supply. It's quite small. I think it's about 1 inch long. It's okay, it's all right to use, but when I do my lips, I want to be as safe as possible. Now, when I say safe, I need to stay away from blood vessels as much as possible, major blood vessels. I need to create as little trauma as possible, and I need it to be as predictable as possible. The technique I use for my lip fillers is the 4mm needle technique. The name kind of speaks for itself. It's a lip technique with a 4mm needle. Can you see that? Only just try and get that focused. There we go. Tiny. Which one of these 3 would you prefer in your lips? I know which one I prefer. All day long, I take the 4mm. All day long. So what's so good about this little 4mm midget needle? Well, why don't we ask Fred? Here's Fred the head. And Fred the head has got some interesting tattoos. What I've done is I've marked up on here the main blood vessels that we're dealing with. We've got the mental artery, which comes up through here, this sort of area, and it splits around about here. And then we have a branch that goes to your lower lip and a branch that goes to your top lip. What we don't want to do with filler is we don't want to get any filler into one of those vessels. That's bad, isn't it, Fred? So what's the big deal about getting filler into a vessel? The big deal is your blood vessels have a job, a really important job. They supply your face with oxygenated blood. So let's just say, let's get Fred back. Let's say we've blocked a vessel here and I've cut off the blood supply to this area of skin up here. This area of skin won't be perfused with oxygen. Short-term pain, short-term bruising. If I leave it and didn't do anything about it, the skin would slowly start to break down. So you'd start to get sort of a bit of peelings, maybe some spots forming. And at this point, if we still left it, this area of skin would die permanently. I'm talking you would need plastic surgery to correct that. That's how serious it can get with fillers. In fact, it can get even more serious than that. If we block a vessel that kind of goes up here and supplies the back of the eye, worst case, having your lips filled can blind you permanently. Which is why it is so important to go to somebody who knows what they're doing. I know I harp on about this a lot, but it's so important, it's massively important. And I think it's underplayed by a lot of the beauty profession because I don't think they accept how important this is and how life-changing it can be if it goes wrong. And the benefit of having a medical professional like me, or like a nurse, or like a doctor performing your fillers is when it does go wrong, we know it's gone wrong. Oh, I'm gonna sneeze. We can recognise if there's an issue. Not only can we recognise it, we can resolve the issue completely. By injecting a different substance called hyalase, we can dissolve all the filler in the vessel, we can dissolve it, we can get rid of the problem, we can prevent some serious complications. Beauticians can't do that. It's a prescribed only medicine. So if your beautician has put something in your lips and blocked a vessel, what's she going to do? Or he or she. What are they going to do? Unfortunately, in a lot of cases, what they'll do is go, oh, it's just a little bit of bruising, it's normal, just keep your eye on it. Keeping your eye on it is potentially watching as that skin dies. Go someone safe. Go to a medically qualified person. I'll get off my soapbox now. So I kind of flew straight in there with the worst case scenario. Worst case scenario with fillers, you can go blind. Slightly less than that, you could require plastic surgery. But there are other less serious complications, such as the fact you're having an injection means you're always at risk of swelling. You're always at risk of bleeding, and you're always at risk of bruising. We'll always try to minimise all of these. We can't guarantee it. Another thing worth mentioning with lips is if you are prone to cold sores, generally it can bring them out. It may be worth asking your practitioner before you have your lip fillers done if they can prescribe you some antivirals, maybe a week or so before. Just try and minimise that. So you're there, you're in the chair, you've had your photos done, you've had your lip cream on, you're nice and numb. I'm there, I've got the needle in my hand, I've got the syringe ready to go. Where am I going to put it? It's not a one size fits all. We place lip fillers according to your natural anatomy. Your lips are so important, they're a focal point on your face, and if you've had your lips done to make them so they're out of proportion with your face, it looks horrendous, it looks awful. Take this for example. Talisa, no. Talisa is a beautiful looking girl and somebody did that to her. That's just a case of badly placed filler. There are anatomical markings and areas and lines that we don't cross. All of those rules got thrown well out the window with that one. Another thing which you'll often see is overfilled lips. You've all seen them. In case you haven't, here you go. Sausage mouth, sausage lips. The sausage lip effect can often be the result of practitioners offering a certain amount of filler per session. You might not need a full mil in your lips. You may only need 0.8 mil. I've got 0.2 mil left. Do you know what I'll do with it? I'll throw it away. Do you know what some people will do? They'll just put it in anyway and make sausage lips. So immediately after you've had your lips done, the filler will go into the lips, and the way I explain it to my clients is it goes in and the filler sits like this. It will take about 2 weeks for that filler to go from this to this. It relaxes, it softens off. Immediately post-injection, you might feel some lumps and bumps, and that's normal. So you'll have your lips, they'll look beautiful, they'll be a little bit sore that day. The following day, I would say most of your lip clients will wake up the next day and go, oh my God, what have I done? Because your lips will feel enormous. They'll feel big because the following day, post-treatment, they do tend to swell a little bit. And the swelling will vary person to person. I personally always regret my lips the following day because I swell quite a bit. I mean, I'm not massive. I could still go out and I still go to work. But to me, they'll feel a lot bigger. So you can expect that the following day. You'll need to use quite a lot of lip balm, keep them nice and hydrated because they will want to suck that moisture in. So lots of lip balm, put on with a clean finger, or even better, a cotton wool bud. So you're not poking around with the injection site. So in summary, if you're thinking of getting your lips done, first thing, choose an aesthetic practitioner that's medically qualified. Then go through with them what your expectations are. Help them choose the product that's right for you. Go through your consent form with them, ask any questions, make sure all the risks are outlined on that consent form. You need to be informed, because if you haven't been informed, you can't consent. Expect a little bit of discomfort during the procedure and a little bit of discomfort afterwards, that's normal. Make sure you get given post-operative care instruction. Make sure you can contact your practitioner in case of any issues afterwards. So if you've got any questions about lips or anything else that I offer, you can always pop those in the comments. I am on Facebook and I'm on Instagram if you ever want to contact me, if you want to book in for an appointment, anything like that. I am amenable to that. So for today, from myself and from Fred the Head, we'll see you next time. Oh, and Fred says, don't forget to subscribe. Bye-bye.